Live from Los Angeles, welcome back to Good Morning LaLa. And on this hashtag Motivation Monday, we are so motivated to understand our health. And it's a very important time because we're talking Graves' Awareness Month with Dr. Raymond. Thank you so much for being with us today.
Thank you so much.
So
appreciate it.
Please break it down for us. What is Graves' Awareness Month and how does it affect the thyroid and eye disease?
Yeah, so Graves' Awareness Month is a month where we recognize an autoimmune disease called Graves' disease. And it's a disease where the bone marrow attacks both the thyroid and the tissue around the eyes. And for most people, it causes them to become hyperthyroid or lose their hair or in some patients become extremely fatigued. But it's an autoimmune disease. And in other patients, it also causes their eyes to bulge. And this, as you can imagine, and creating eye bags and even vision impairment, you can imagine how that impacts their daily life.
Wow. So what are some of the first symptoms a person might notice?
So the first symptoms are either how you feel, whether you just can't sleep, you're always hot when everyone else is cold, or vice versa, losing your hair. And the other is when you're just looking in the mirror and you're like, why are my eyes retracted? Or you take a photo and you just look different and your eyes are beginning to bulge or become red. Those are some of the first signs.
Wow. The eyes are, said to be the, window into the soul. Yeah. So it's interesting that you work on the eyes. You do all kinds of things. You do things with the lids. What else do you do? Well, I'm sure you do all kinds of things.
Yeah, so I do a lot of surgery around the face and around the eyes. So both half of my time is trying to make people look better and do cosmetic surgery, and the other half is more this surgery on Graves patients where we're just trying to make them be you again. And that gives them such confidence and an enormous amount of ability to go back into social life.
Wow. Interesting. So how's Graves treated?
Well, it's treated in two ways. First, you treat the thyroid, and you can do medication or even surgery to treat the thyroid. It's often a lifelong treatment. Some people can get off. And then the eye disease is mostly surgical at this point in time. So that's the most satisfying part of my career and day.
We also mentioned an anti-inflammatory lifestyle on the break. Can you tell us a little bit about that and how that might contribute to one's health?
Yeah, so it's a big part of what I've been doing in the last few years is not only just treating patients surgically, but helping their family understand what they're going through from a psychosocial standpoint, but also diet and exercise, because that just has a tremendous impact upon your immune system. So a pro-inflammatory diet is where your immune system is always working. It's always being inundated by what you're eating, and it's always on a rampage. And at some point in time, it can find things and cause an autoimmune disease. And what we try to do is talk to them about an anti-inflammatory diet. And essentially, there's a lot of different versions of that, but it really is reduction of milk, gluten, a lot of animal protein reduction.
And I'd imagine sugar.
And sugars.
Didn't want to say that one, but
that's a huge one.
Yeah, absolutely. So how did you discover this to be a passion of yours? Is it something you've always been interested in, or?
Well, for about the last 15 or 20 years, I have actually. I did a PhD in immunology and all the boring science stuff, and then it just started to kind of come together. And lately, I've just been so interested in the health and wellness aspect of how to pull it all together, not just from the science, not just from surgery, but how to pull life together, as you've been talking about all morning.
Wow. Thank you so much for the work that you do, Dr. And please tell everyone where they can find and follow you.
Oh, sure. It's RaymondDouglasMD.com, but we're all over the internet and social media. We do a lot of podcasts and social media outreach just to help people with support.
We truly appreciate that.
Thank you so much.
Stay tuned. We'll be back for more on Good Morning LaLa.